What does a contraction feel like? How do I know if I'm in labor? And what does the day of labor look like? Wait, is this normal? Hey, I'm Heidi Campbell, a certified birth doula, host of this podcast, Birth Story, and owner of My Doula Heidi. I have supported hundreds of women through their labor and deliveries, and I believe that every one of them, and you, deserves a microphone and a stage. So here we are. Listen each week to get answers to these tough questions and more. Birth Story, where we talk about pregnancy, labor, deliveries, where we tell our stories, share our feelings, and of course, chat about our favorite baby products and motherhood. And because I'm passionate about birth outcomes, you will hear from some of the top experts in labor and delivery. Whether you are pregnant, trying desperately to get pregnant, I hope you will stick around and be part of this tribe. Hi, Gail.
Hi.
Tell us a little bit about yourself.
Oh, goodness. Well, I am the middle of three girls. I'm originally from New Hampshire. I'm married to my college sweetheart. I'm in medical device sales, so I work in the operating room. And twin boys that are 10.
I'm so excited to just dig into this story. And we have a box of tissues, so we should probably say trigger warning, right?
Probably.
So we're not going to jump too far ahead, but the twins were born very early.
I think the technical term is actually micro-preemies. Any baby born before 27 weeks is considered a micro-preemie.
So trigger warning. We're going to probably cry. I got some tissues and we're just going to dig in. Gail, let's start with getting pregnant.
Yeah, so wasn't easy for me. I was diagnosed with Hashimoto Thyroid Disease, which is autoimmune thyroid disease, essentially. So my body started attacking my thyroid, and when we were trying to get pregnant, that was discovered because it just wasn't happening.
Was that family history or what?
No, it has nothing to do with that, I don't think.
Okay. So it's just as a random...
Right. It's different than an underactive or an overactive thyroid, which is very common, but it's an actual autoimmune disease that I just never knew I had. Some of the symptoms are coldness and hair loss, and I didn't have any of those symptoms, but your thyroid affects your menstrual cycle. And so I wasn't ovulating, essentially, because of that.
Did you... I had no idea. You knew you weren't ovulating. You weren't having a period?
No, that's what was tricky about it.
Okay.
So sometimes I would go without having a period. Sometimes I would have a period, but you can actually...
ovulate. You can shed the lining of your uterus without producing follicles.
Yeah, that's where it kind of started. And so eventually we decided to do Clomid. And I kept that. I was really ashamed of all of that. I kept that very close to the chest.
So pause right there.
Yes.
Did you get Clomid from your OBGYN or from a fertility clinic?
No, I never went to a fertility clinic. My OBGYN was trying to figure out, in conjunction with a reproductive endocrinologist who diagnosed me with Hashimoto and got me regulated on Synthroid and got those levels in check.
Okay.
And then they said, you're good to go. And I still didn't get pregnant, wasn't getting pregnant. And so my OBGYN said, let's just try Clomid. It's probably not going to work.
How long?
Literally the first month I took Clomid.
No, how long did you have... How many months did you go without getting pregnant while actively trying?
From start to about 14, 15 months. So after a year, they, when you've been trying for a year, that's when they kind of start talking about Clomid.
How old were you?
26.
So at 26 years old, you had this thyroid condition. You tried naturally to get pregnant for over a year. And then they said, hey, why don't we start Clomid?
Yes.
And then you...
took Clomid.
But you said you were living in shame about that.
Totally.
This was 10 years ago?
Yes, 10 years ago. Because at the time, I did not know... really anyone who had a hard time getting pregnant. I know it's very common now, but I didn't know.
It was common then. It's been common for a long time. I'm just so glad that you're on the show talking, because the more we have these conversations, the more it's going to empower women to not feel alone.
Right. I had two friends that knew everything. Okay. But outside of them, part of it is that it was just really a hard time, and I didn't want to talk about it to everybody. And in the job that I had then, I knew so many people, and I was in, pharmaceutical sales. And so people knew me, but that was a part I just wasn't really ready to talk about, I think. And also, you're scared and there's shame because something doesn't work right in your body. And I was young. I mean, going back, would I have shared it? Yes. Now, obviously I'm here, but, then I just wasn't there yet. I didn't have maturity at that point.
Did you and your husband, were you in active dialogue about it, or were you just tabling it?
It was pretty much kind of we didn't talk a ton about it. He was scared a little bit too, I mean, the thoughts of well, what if we can't have kids, and how long is this road going to be? And so, he was very supportive and concerned, but we didn't focus all of our dialogue on, we tried not to, but I was pretty consumed. I personally was really consumed with him. He's super chill, and at one point said to me, I married you, and if we never have kids, my life is completely full because I love you, and you are the reason. You are more important to me than anything. If for some reason we can't have kids biologically, we'll either adopt, or he never made me feel like it was going to cause division in our marriage at all.
Oh, that just tears in my eyes, that you have this man that's telling you, I'd rather be your husband than be a dad if I had to choose. And that's just oh God. Okay. Just get me from the beginning. So, okay. Take a breath. Walk me through when you started Clomid. How did that make you feel?
Nervous and excited.
Okay.
Excited because there was now just hope, that, okay, we're going to do an ultrasound. My doctor was very clear about we're going to take this. You can take it up to 6 months. Don't get your hopes up. You haven't really had a normal cycle in quite a while. So let's see how your body responds to the Clomid. So I took that, went back in and had an ultrasound, and she said, it looks like there's one good follicle, maybe two, but don't get your hopes up. But, you've got a 48-hour window, get to it.
Yeah.
And we'll see you back, in about 2 weeks, because you take Clomid, I think you start on day 10, or I think it was day 10 you start.
And is it oral?
It's oral. It's just a pill.
Okay.
It's just
a pill.
Just a little pill. You don't feel, she said there could be, hormone imbalances. You might be moody. You might be exhausted. You could have a physical response to the Clomid, but I never had any of that. I took the pill. I felt for the first time in, over a year was this could actually happen.
I have a follicle.
I have a follicle.
Yay. Maybe two.
Yes.
Okay.
But even at that point, we didn't talk about twins. We didn't talk about multiples, because even with Clomid, the percentage is 3% multiples. Clomid's the first step in fertility from, I don't know if things have changed since.
I believe it's still the first step. Mm-hmm.
So, it's still a relatively low percentage of people who have multiples that route. My doctor didn't even mention multiples at my appointment. She said, just see, and actually made me think it was more likely that it wouldn't work. And so not to get my hopes up again, At day 27, I was like, I can't wait any longer. I had an appointment, for the following week, because she said, just set an appointment. Either way, I want you to come in. Okay. And I couldn't wait. I got home from work, took a pregnancy test, and I mean, the minute that pea hit the stick, it was the brightest red line for a positive test I'd ever seen. And I had a couple of times thought maybe there was a chance I was pregnant through that year before, and taken tests and waited and looked in different levels of light to see if maybe there was a faint light. So I knew,
Yeah. This was definitely positive.
Yes.
Wow.
Yes. I was so excited.
So the first time, like
The very first time.
Clomid round.
Yes.
There it was.
Yes.
Oh my gosh. And so how'd you tell your husband?
I told him he had to come home early from work. I think I was home at 4 o'clock or something that day. I was home early and he knew. And we just both I was shaking. I didn't have the response that I literally started shaking. I didn't cry. I was just I just could not believe it. And we just hugged each other. We just talked, I can't believe this is happening. We're pregnant at all. So went to my appointment and Micah came with me. They started doing the ultrasound and I had never really seen an ultrasound.
This would have been like an internal vaginal ultrasound that early on.
Yes.
Okay.
And she starts pointing to the screen and I could see 2 sacs, but I didn't know what I was looking at quite yet.
Yeah.
She's like, okay, so we have 2 sacs here. And one very clearly had a green kind of light to it that you could tell there was life there. The other didn't. And so she said, can you see this? This is the beginning of a life. And so we have one here and we're so early, I don't see anything in this one. So you may have twins or you might have what's called disappearing twin syndrome. We don't know if these were identical or if they're fraternal. We don't know. You have to wait another 2 weeks till 8 weeks.
Oh no. Okay. But you were still oh my goodness, there's babies
we were
in there.
So excited.
Yeah.
So we decided not to say anything about twins because we just didn't know. Okay. And told all, our immediate family and a few friends. And then we just kind of waited. And at 8 weeks, we went back and there was another heartbeat.
At 8 weeks, was it also an internal vaginal ultrasound?
Yes.
Okay.
And she was like, well, he just was a little late to the game, but yeah, you've got 2. Oh, welcome to the world of fertility and Clomid. This was
I've got a question for you now.
Yes.
I'm going to jump ahead a little bit because I know your boys are Isaac and Mason, and Mason's always been a little bit smaller than Isaac. Do you think that one was Mason?
Yes.
Okay. Do you know that for sure?
Yes. Well, because of the position, baby A and baby B, that's how you kind of talk about twins throughout a pregnancy, A and B. And I would imagine with triplets, it would be C, A, B, C. He was always 25% smaller.
Okay.
And even at birth, he was roughly 25%.
Was he baby B? Or was he
was.
Okay.
He was baby B. And so the thing that we don't know was that Clomid or was that my body actually did ovulate after the Clomid was out of my system? Because he was conceived later.
Wow.
At least a couple days. Yeah. Most likely.
Unbelievable.
Because he's smaller.
And the sperm stays alive for a couple of days.
I mean,
so this is just
crazy.
Unbelievable. Okay, this is 8 weeks.
So 8 weeks, we start telling people we're having twins. I was exhausted.
Okay.
I was exhausted. I was a little nauseous, but I think I only threw up one time during those initial, 2 months really of my pregnancy. Yeah. I wasn't sick. I felt like I could just go into a coma sleep that I had never experienced before. I would come home from work and just fall asleep and wake up at 8. My husband would be like, "Are you okay?" I'm like, "I'm just so tired." And then right at around 12 weeks, I felt like I hit some sort of a stride. I mean, my face was glowing. My hair was glowing. I was so alive. And that fatigue had really left. My first trimester was just a tired one, but then I felt amazing. I really did. And I look back at pictures, I looked so alive. And I remember saying to my mom, was this how your pregnancies were? Because I feel better than maybe I've ever felt before. And I wasn't ginormous yet, as far as I was gaining a normal amount of weight. My belly was obviously growing and I looked more than 12 weeks pregnant probably to most people, but I felt great.
Was the Hashimoto's in remission while you were pregnant?
No. So I was having to go and get regular like every appointment with twins and with all the Hashimoto, I was going to the doctor about every 3 to 4 weeks. Once I was like every 2 weeks until 12 weeks. And then I went at like 15 and 18. I was going more frequently than normal, and they were checking my thyroid, and it was never quite in check.
Okay. So are you able to take thyroid medicine when you're pregnant?
Yes.
Okay. So you continued to take Synthroid?
Yep.
Okay.
And they would just adjust my dose. I think we adjusted it twice early on, up. Primarily you're going up because my body doesn't make TSH. So.
Okay. So your belly starts growing. Like, when did you notice that you were showing? Do you
I felt like I was showing at like 10, 11 weeks.
Okay.
And then, I went through periods where I didn't feel like it was growing much. And then all of a sudden I would wake up and I would just feel like I doubled in size. And 15, 16 weeks, I was really showing. I looked more like I was probably 20. I was always about, I would say, a month, maybe bigger.
Than someone who was carrying a single.
Yeah. And then around 20 weeks, I got pretty big.
You're feeling good. Your pregnancy's going great. You're going to all your appointments.
Yep.
Did you have a baby shower?
I had 2 planned.
Okay.
For 28 weeks pregnant, and then another one at 32.
Okay.
So because, as we were getting to the 22 week time frame, my doctor was saying not all twins make it to 40 weeks. And, I wanted to have a natural birth and didn't want to, I was kind of priming her for, I didn't want a C-section and I wanted to do this and I think that I could. And, I don't want to go early if I don't have to. And I was beginning to think those things and
starting to formulate a birth plan.
To some degree. But I also was not as, I didn't have a doula, and I wasn't reading tons and tons of books. I was very simply, I was just enjoying my pregnancy, and I was working, and
most people start to panic and start buying books and stuff 30, 32 weeks, you know? So it's not abnormal that at 20, 22 weeks, you wouldn't have started any of that. You're just, and a lot of people will describe it sometimes they forget they're pregnant. That they feel so good some days that then they look down and are like, oh yeah. Did you have any of those days where you felt so good that you were just oh yeah, there's 2 babies?
Yeah, I think so. And I think, because it hadn't come easy, I think, I would maybe forget just how great I felt that, there's 2 growing inside of me. But I think it was possibly a little bit different. And my days, I just felt wow, I can't believe I'm getting to experience this. I have this secret, and I'm part of this new world of pregnant women and future moms. And I thought about that a lot, that I was I don't know, in a completely new phase of life, really. And I loved it.
Yeah. All right, Gail, let's jump from where you were at that 22-week mark to 24.
Okay. So around 24, 25 weeks, I was starting to have a lot of back pain, lower back pain, to the point where I would get in my car to go to work and I could not find relief. I tried different pillows. I was moved to tears. It hurt so bad. And I would get out of my car and stretch and I would feel better. The back pain was really very, very real. And then I also had a fair amount of swelling in my ankles and my lower extremity leg area from time to time. And I couldn't really place when that would happen. It wasn't just when I was standing for a long period of time or driving. It was sometimes random times, early in the morning or late at night. There was no real rhyme or reason to it. So,
were you telling your doctor about this?
So I had a appointment on Tuesday of 26 weeks. You're counting your weeks. Every Tuesday was a week. So I had a 26-week appointment, and I was waiting to talk to my doctor then, which I did. So I went to my 26-week appointment, and
you shared over the last 2 weeks,
yes,
these things have been occurring.
Yes. And what I didn't do was tell her that it hurt so bad that I was, moved to tears. or make it a big deal.
Scale of 1 to 10. What do you remember your pain being?
An 8.
Oh, okay.
I was like, and I have a pretty high tolerance for pain, but I don't know why I diminished it. I think, in retrospect, I just thought, well, maybe pregnancy is just painful, and maybe I thought I had a high tolerance for pain, but I really don't. But in retrospect, I was in a lot of pain.
Okay.
The swelling was not okay. There was nothing okay about it. But my language to my doctor was, this is what's happening. I told her, and I said, what do you think about that? And she said, honey, that's par the course. Like, twins is a lot on your body. I had gained 30 pounds, which was good. And she said that has something to do with it, but everything looks good. And she said, I'm going to check your cervix in 2 weeks at 28 weeks. I'm not going to check you today. We did an ultrasound. Everything looked good. She sent me home with my orange glucose bottle, and my next appointment would be to do the glucose test and a cervix check.
When they did the ultrasound, did they do what's called a Nonstress test, or they put a blue and pink strap on you to monitor contractions to see if you were having any?
No.
Okay.
No. And at this point, preemies were not she never talked about going into early labor with me. Again, I didn't know anybody with twins and never had met or known a friend to have a preemie. So it just was not on my radar.
Yeah. Did she tell you to do anything like go to the chiropractor or take Tylenol? Like, did she give you any strategies?
Just rest. She said, you really need to get off your feet. You need to get off your feet at the end of the day, and you need to take it easy and rest. And
but she didn't want to put you on, bed rest or something like
nothing
write
like
you
that.
out of work. Okay.
No,
so
nothing like, I had back pain, but it hadn't lasted about the entirety of my pregnancy. It was somewhat recent, and I thought, well, maybe it'll go away,
Yeah.
So that was a Tuesday. On Friday morning, I had a breakfast with one of the offices I worked with, and one of the doctors in there looked at my ankles. I was with several coworkers, and she said, I don't like the way your ankles look. You need to sit down. And she's like, you're really swollen. She tried to get a pulse down by my ankle, and she said, I can feel your pulse. It's kind of weak. I think you should go home. So I went home on Friday and just rested. And
did you call your doctor?
No.
Okay.
Didn't call my doctor. That night, I laid on the couch and my back was just throbbing. Okay. And I was telling Micah, I don't feel well. Like, I just don't feel well.
Did you feel nauseous?
No, but I felt
weird.
Ill and weird.
Okay.
And my back was it felt like it was pulsing. Lower back pain, pulsing.
Okay.
Now, I had Braxton Hicks. I knew what that felt like on the front of my belly. I knew what those short, little tight spasms felt like, is how I would describe them.
Yeah.
And I wasn't having those.
Okay.
So went to bed Friday night, slept through the entire night.
Okay.
Woke up Saturday morning, went shopping for maternity clothes, and I was in the dressing room at Nordstrom, and I had a sharp kind of pain in my leg, like up through my groin area, and it made me double over. In the dressing room, I was like, oh.
Did it feel like a lightning bolt?
Yeah, somewhat like that, yeah. Okay. And I left the dressing room, left all the clothes in, went home and lay down.
Okay.
I'm like, I just, again, don't feel well. Micah was out with a bunch of friends that day. I don't know if he was golfing. He was doing something. Came home later, and I said, I still don't feel good, We watched a movie Saturday night, went to sleep, and, I was praying, like, please, I just pray that these whatever this is, this sickness, or maybe I was getting sick, I didn't know, these back spasms would go away.
Did it ever cross your mind, I'm in labor?
No.
Never. Okay.
I thought something might be wrong, but it never crossed my mind that I was going into labor.
Okay, so let's time out right here, because this podcast is supposed to be about you telling your story, but it's supposed to be education to empower women to have knowledge for their own pregnancies. If you could go back to Gail 10 years ago, in that moment, what would you tell her?
I would have told her to call your doctor. You don't know what you're doing. You don't know what's going on. Your lack of knowledge is irresponsible. I feel like I was really, and I had to deal with a lot after the boys were born, because I was like, I always thought I was smart. But I didn't know what to ask. What I would tell her is, call your doctor, ask questions, be on top of how you feel, because how you feel matters. And it's not just your body. There are babies there. And just because everything's been perfect doesn't mean I knew something wasn't right. And I don't know, whatever fears you have, Gail, get over them and ask questions. Like,
okay.
That's what I would say. No question is a dumb question. No feeling that your body's feeling like you think you might be overreacting is an overreaction. It's your body,
Yeah.
And
I would say the pain scale is a really important tool for communication. So kind of think about that 1 to 10 and to be communicating, yes. Where are you? Where were you yesterday? Where are you today? Where are you tomorrow? And making sure you're tracking that pain
yes.
scale with your doctor.
Yes.
I think is a good way for your doctor to be like roped in on how you're actually feeling. Yeah. Okay. So thank you. I just wanted to there's going to be women that are listening to this podcast that are pregnant with twins that are approaching 26 weeks. And we want to make sure that we are teaching them, if you start feeling a level 8 back pain, call your doctor, right? That's a good takeaway, right? So that Saturday night, you go to sleep.
I sleep all night.
Sleep all night again. So Friday night, slept all night. Saturday night.
Woke up, no back pain.
Perfect. So you're like, God has answered my prayers.
I am fine. Okay. This is over. And again, that's a little confusing when you're in labor. You don't know that it can be intermittent at times. Okay.
And where we're going, this to me sounds like what I would call prodromal labor.
Okay.
It kind of stops and starts. And this is, again, preterm prodromal labor, but where it stops and starts and stops and starts. But it's coming more consistently than Braxton Hicks. Mm-hmm. But yours was presenting so differently. Right. Yours was presenting as back pain.
Lower back pain. So Sunday morning, I go to church and have a similar shooting pain type feeling. Okay. My friend next to me that I was standing next to has already had 2 kids. And I reached over and I was like, I'm like having is shooting pain normal, And she's like, totally, And I sat down, went away, went home. We went to the pool with some friends, and I was in the pool, and I looked at my friend, and I said, it was the first time, and I don't even know why I said it, but I was like, I am in so much pain right now. How do you know when you're in labor? And I said, can you be in labor and not have front contraction pain? And this friend too had 2 kids, and she's like, oh yeah, you can have back labor. And when she said that, it was like a light bulb of the last 72 hours just kind of going off. My husband went and got the car. I got in the car, literally soaking wet from the pool. And I called the nurse, and it was a Sunday. So it was an answering service. I called my doctor. It was an answering service. She asked me a series of questions, and she said, go straight to the hospital. We've already called them. They're waiting for you. We think you're in labor.
Now we're going to take a short break to just share a few things with you, and we'll be right back with our guest. Hey guys, if you're enjoying this podcast, then I need your help to spread the word. If you know anyone who is pregnant, is trying to become pregnant, or just loves a good birth story, if you could send them to iTunes or Stitcher or Spotify or SoundCloud, wherever they listen to their podcasts, and ask them to subscribe to the Birth Story podcast.
So I went to the nearest hospital, which was about 15 minutes away.
Was that where you were planning to deliver anyway? Or was that just the closest hospital?
Closest hospital.
Okay.
Yeah. And walk in, they were very, very ready for me. And at this point now, though, I am like doubled over in pain. So my pain was and I was having lower back and lower abdominal, menstrual cycle type cramps.
Okay.
At this point now, it was all coming on. I was feeling very nauseous, lightheaded, a lot of different things.
At this point, did you believe you were in labor?
Yes.
Okay.
Yes, I believed that. My husband and I drove in silence, and he just like had his hand on my leg. He didn't even know what to say. He's a pretty quiet guy.
You were 26 weeks and how many days?
5.
26, 5. I'm sorry.
So.
Okay, let me just grab a.
So I get there, and they wheel me back, or not wheel me, but yeah, they put me in a wheelchair and wheeled me back to a room, hooked me up on a bed. And I mean, they're just moving quickly with all different kinds of things. And a doctor, I don't know, she walks in because it's Sunday. She's not my doctor. She's like, I work with, such and such practice. This is my first weekend on call. And I'm really excited to meet you, and let's see what we have here. And she looks up at the monitor, and I said, this pain that I'm having right now, this back pain I've been having for like 2 days. And she's like, honey, what you just experienced was a ginormous contraction. Do you see that on the monitor? And she checked me, and I was 5 centimeters and 90% effaced. And it was like 2:15 in the afternoon.
Damn it. I'm sorry. I'll probably cut that up.
So, we were just like, what is okay? We're having these babies. And
did they say that it was possible to stop labor at this point?
So she said, I need to get a game plan together. I'll be back. And in about 20 minutes, she came back, and they started pumping me with magnesium. And she starts talking about to stop the contractions. So they give you potassium to induce you. Magnesium has the opposite effect.
Okay.
And so we're giving you magnesium. They're shooting me with shots of surfactant for their lungs. I mean, the information she was throwing at me was just like drinking from a fire hose. Like, we're going to try to hold you off for 48 hours so that the surfactant can work on their lungs, because lung development is what they were most concerned about. And the boys, their heart rates were fine, so they weren't in imminent danger at the moment. And then she left. And so I was there, and I'm looking at Micah, and he just looked like he saw a ghost. We weren't talking. I mean, at this point now, the magnesium with that dripping, it makes you feel like you're on fire on the inside and makes you very sick. So I am doubled over. I'm writhing in pain.
The contractions were still coming.
Oh, yeah. They were coming, and they were coming with like a vengeance. My body was...
expelling your babies.
Was not happy. And so around 4, I went through that for about an hour plus. And then around 4, a nurse came in, and I said, I don't feel good, and I don't think this magnesium is working. And the nurse said, I'm just going to check you. And she picked her head back up. And as soon as she did, my water of the first sac literally, like, when I say it burst, it hit the TV unit in front of my bed. It like exploded. Wow. And I was kind of screamed. I was scared. And then there was intercoms paging people, and she said, you're crowning, basically. So we're wheeling you they were going to put me asleep and they were saying a couple of different things. I didn't really know what was going to happen, but I knew that I was being wheeled out of that room and into an OR when the plan was to do a C-section, but I guess Mason was crowning at the same time. I at the time, none of it was making very much sense to me. And I was blacking out some of the time because I was in so much pain from the contractions.
Yeah, you're in transition. And I had no epidural or anything like that. Yeah, I'm like, you're in transition.
Right.
With natural labor, with twins.
Yes.
I can't. I mean, it makes sense to me to hear you say you were blacking out in pain.
I actually at one point thought I was dying when they were wheeling me into the OR. I felt like all the life was draining out of my body because I was probably losing a lot of blood, and I felt like very weak. And I remember thinking, I wonder if this is how it feels to die.
So many people have experienced that in childbirth, especially when you hemorrhage. And it's more like I'm about to pass out.
Right.
So I think anyone who's passed out and kind of their blood pressure drops and their pulse drops and they're bleeding and they're scared. It's actually a pretty normal feeling. I've found that there are also people that are listening to this podcast that are healing from their births, that aren't just pregnant. And so that's something to say, like, this is normal.
Yeah.
Many of us have felt that feeling.
Yes.
And you're not alone.
Yeah. So let's see. From there, we get into the OR. And
where's Micah? What's Micah doing?
They told him he had to stay out because the plan was to do a C-section. So he called my parents, who live, 20 hours away, and told them, get here. And he would tell you he was so scared. He didn't know if I was going to be okay. He certainly didn't know about the boys. And my parents have known him since he was 18, because we were so young when we started dating. And my mom said that his voice was like shaking and he could hardly even get the words out, and just said, you have to get here now. And my dad thought I was going to die, and he, they were all just so terrified. It's just terrifying.
Yeah.
That whole scenario. No.
Did you feel like the boys were going to be okay?
No. And I thought, how can they live? They're not done. How is this I thought surely something would be wrong with them, or they wouldn't make it, or I had no idea how much they were going to weigh. I didn't know anything. I mean, I literally...
You were just scared.
Yeah. Looking back, I was thinking more about whether or not I was going to be okay. Like, what was going to happen to my body? Am I actually delivering them? And then when I realized that I was, the thoughts of whether they were going to, I didn't think they were going to be alive. I didn't think it was going to be possible for them to make it. No, I thought it's very possible that we're going to go home without. Yeah. But I wasn't thinking that much because I was in so much pain. I remember those thoughts. But I wasn't thinking all that much because of the pain, I guess is what I'm trying to say.
And if you did think it's very normal to think, am I okay?
Right.
Right?
Right.
In labor, most women will tell you that they had a hard time. They would ask every now and then, is the baby okay? But for the most part, you can't think about anything else other than, am I okay?
Right. And I think that's what I was thinking, mostly about myself. Not because I was being selfish, but because I just didn't know what was even going on, what was happening. Right. It was all so shocking, and I didn't have time to process anything.
Were you they said he was crowning. Were you having the urge to push?
Yes.
Okay.
It's the minute I was wheeled into the OR, they said, we're not doing a C-section for baby A. You need to push. He's crowning.
Okay.
And so then another doctor arrived. So I had the doctor who had initially seen me from my practice and another doctor who they paged that was in-house, another OBGYN who I had never met, a male who came up and was kind of standing near my head, and he was telling me how to push.
Okay.
And the other doctor was was down and talking to the nurses that were there. And there was clearly a lot of commotion with, at the time, I didn't know what it was, but neonatal beds and ventilator machines and things like that were being wheeled in.
Okay.
I was ineffectively pushing, but I had the urge to push, and so he kind of coached me through that, and Mason was born, and I didn't hear a cry or anything. I felt the relief.
Mason was born first?
Yes. So wow. They had inverted. Baby A was not born first. Baby B was born first. And so he was born first, and they whisked him away as fast as he was born, it felt like.
And Micah was still not in there?
Then Micah came in while I was pushing.
Okay, so they did let him come in for the birth.
Yes.
Okay.
And he was just kind of crying and up at the top of my head.
Okay.
And then they were talking about cutting me to get Isaac out because he was in distress. They had an ultrasound machine. So there was just a lot at that point going on. You know, the doctor, the male doctor was ultrasounding my belly, and he was saying now baby B, which was baby A, is breech. So we can't deliver vaginally. We have to cut you open. And then the doctor said, no, I want to try to invert the baby. So he got up on top of my belly, on the bed, basically.
Okay.
And inverted Isaac, turned him completely around and pushed him down.
And again, you have drugs.
No, I'm blacking out. I'm like in so much pain that I am blacking out. And they burst my water sac.
Okay. With the version.
With the version. And burst. Now, actually, the doctor that was down below, she ruptured the water sac that Isaac was in. Literally like went all over her face, Micah said. And they said, go ahead and push. And so I pushed him out, and I heard a faint little cry.
Oh, wow.
Yeah.
And you hadn't heard Mason?
I hadn't heard Mason, so I had no idea what was happening with him. Okay. And, you know, after Isaac was born, it felt like the whole world like disappeared. I was shaking, like crazy shaking. And I had to deliver the placenta, which I did.
Did they have two placentas?
So both placentas.
Okay.
And there was, you know, stitching, and there was a lot going on. And I felt like the entire time all of that was happening, I was just like this crazy cold shaking mess on the table.
Yeah.
I remember that, and I don't remember all of the, you know, how many minutes all of that happened.
And that's normal. Has anybody told you that almost all women do this right after birth?
Shake?
Yeah.
Yeah.
Yeah. It's totally normal, and it's super weird, but like shaking from head to toe.
Right.
Yeah.
So, and then Micah disappeared because he was over with the boys. And then shortly after that, they brought Isaac over to me, and he was intubated.
Okay.
So, but they brought him over, and I turned my head, and all I saw was his little face. And I like turned my head away because I just started sobbing for the first time. Like I actually was able to have some emotion. And Micah kept saying, he's beautiful. Like, oh, he looks so great. And all I could think was, he doesn't even look like a baby. He didn't even look like, his face didn't look complete. Like I just had never in my life seen a baby like that. And so then they whisked the boys out and wheeled me into my room and gave me drugs, and I fell asleep. And when I woke up, this was 4:09 and 4:17 that the boys were born.
Okay.
So I got to the hospital at 2.
That is so fast.
They were born a couple hours later.
I mean, they were only 8 minutes apart.
Yes. So the whole inversion, all of that was very, very quick. Okay. And when I woke up, I looked over at the board where they, like, you know, on the little dry erase board where they write the name and the birth and like who you are. And that was when I saw their weight. And I felt like I had gotten punched in the stomach, and it just said baby A.
Which is now who?
Mason.
Okay, so they've changed their...
Yes, orientation.
Okay.
1 pound, 12 ounces. And baby B, 2 pounds, 1 ounce. And I initially just think there's no way they're going to live. You know, how can a baby that small survive? And the weight, seeing it written out it was just overwhelming to me. We hadn't seen the boys really. Micah saw them a little bit more than I did in the room, but they had shut down the NICU unit and were really trying to care for them. This particular hospital really wasn't equipped for babies less than 28 weeks. A Micro-Preemie, there's different equipment that they need, from what I understand. So the neonatologist came in and said, you guys have two options. The boys are alive and they're intubated, but we really either need to airlift them to a more equipped facility, but you run the risk of brain bleeds and just different things that can happen in transport with the preemie, or you can wait, keep them here, and let's see how they do through the night. And it seemed like eternity. Mike and I just kept staring at each other, like, how do we make this decision? You know, you're deciding whether could be potential damage to them, transporting them, but it might be what they need. We just didn't know. And so I looked at the doctor and I just said, well, what would you do? And she said, I'd stay the night. I'd stay here. I'd have you stay here, and I would have them stay the night, see if they make it through the night.
Oh, God.
And so...
like to have a doctor say to you, if they make it, if they make it through the night. I'm so sorry.
Yeah, and it was, you know, it all happened so fast that it just took time for me to, like, long after, you know, we'll get into the NICU a bit, but long after that, like, you realize, gosh, there's no preparing someone for a traumatic birth like we had. You know, there's no way to prepare yourself for how you're going to respond when a doctor says some of those things. You know, we had that first night, and, you know, we saw them. They were literally wrapped in, like, saran wrap. Their skin was paper thin. Their heads were disproportionately, like, larger than their body. You know, preemies have a different look. And, you know, you dream of this, like, plump baby that you're going to deliver. And you know, getting to the point where you just want that baby out. You know, those are the stories that you hear most of the time. And I felt like we all got robbed. But I also knew that God was in control, and my faith was being incredibly tested. And I felt that even in the moments of, like, making the decision to keep them there and seeing them for the first time, and, you know, feeling my belly, and they're not in there that first night in the hospital, and just thinking, this is altogether wrong. This is not the way it's supposed to be. That's how I felt. So
they made it through the night?
They made it through the night, and they went through a series of tests the next morning, and they both had VSDs and ASDs, which are just, you know, heart ventricular septal defects and atrial septal defects, where they're just not complete. You know, their lungs were very, very weak. And so we knew there were some issues there. We didn't know about brain bleeds until about day 3 of being there. And I had tons of people coming to see me. You know, I was only in the hospital for 2 days. On day 2, my parents arrived. All my coworkers arrived. And actually, something that you said, you probably don't even remember, Heidi, when you came that next day to the hospital. I was sitting there, and I wasn't really crying. You know, I was a little numb. I was a little just in shock, I think is fair to say. And you guys all walked in, and you came over to me and gave me a big hug, and you were crying, and you said, "I'm so sorry you lost your pregnancy." And you were, like, whispering it to me. And I think because you knew that that's what it was. It was going to be a loss. It wasn't that I had preemies. It was a loss, and it was an unknowing of what could have been. And I did, you know, I've had a miscarriage since then, so I know what it's like to lose a pregnancy. But I didn't recognize it then when you were saying it. I just thought this was a traumatic event. But it was a loss. It was a big loss.
Big loss.
For all involved.
3 months.
Yes. But 3 months, it's amazing how every day matters. And so we walked through we walked through those initial days, and we left the hospital when I was discharged, and we were on the way home, and my husband, like I said, man, a few words, he was just holding my hand, and he said, this is the type of thing that changes people. We will never be the same, no matter what happens with the boys, whatever the outcome is, we won't be the same. And I was so scared. I thought, am I going to be a better person? Am I going to be how is this going to change me? And how is God going to use this in my life? Because, I believed that that God is the one who gave me the boys. And I know this podcast isn't about our faith, but it's a big part of my life. And I knew that
anyone who's listening to this podcast listened to episode 1 and knows that I'm a big believer in Jesus. We're going to talk about, pregnancy and birth is such a spiritual experience. Motherhood is such a spiritual journey. So,
but I didn't understand. I was like, I know you gave him to me, but why all this? And it took so long, honestly, for me to even get some of those answers, and to have a really, really hard time, and to see how compassion can grow out of tough times, and, humility. And there's a lot of lessons I learned early on, and really feeling alone actually drew me closer to God, because I felt like nobody really could understand. Micah couldn't, my parents couldn't, not a single friend. My situation too was just, they were in the NICU, and I stopped working, and I took leave, and my life changed completely overnight. And I was dealing with a premature birth, and my responsibility in that, and was I responsible, questions like, should I have ever taken Clomid? Was my body never intended to have twins? But God knew all of that. And, working through some of those, how could I be so irresponsible and not know I was in labor? And
when you say work through those, did you go to counseling?
So, I tried counseling, and I just didn't have a great counselor, so I didn't stick with it. No, a lot of journaling and praying.
Okay.
And talking. I started talking to Micah. I started getting some things out. I started talking to my mom about how I felt. After about a month, I would say I started talking. I mean, everybody was trying to throw all kinds of pills at me when I first came home, because I was so depressed. I was not speaking hardly, very little about what I was feeling.
You were in shock?
Yeah.
Physical shock.
Yes.
Tell me about, you had to go home.
I had to go home. Mm-hmm.
When did you go home?
I went home on day 3 of the NICU.
Yeah.
They kept me one full day after, and then I went home the morning of the morning was Tuesday morning. So it would have been 27 weeks the day that I went home.
And do they want you to actually leave the hospital? I understand that you need to check out of your room, but did you just want to stand at the window, or do they want you to actually leave and go get rest and then come visit your babies? How does that go?
So the NIC unit is not where they keep babies with windows. There are no windows to the NIC unit. It's a private door.
That's like a movie thing I've got in my head.
Right. No, and especially if you're not at a ginormous hospital, it's a little door with a sign on it, NICU, and it leads you. This particular place had room for 7 or 8 babies, and if you are a parent, you ring a doorbell, and they let you state your name, and you go in, and you have to scrub your hands like you're going into a surgery, every part of you, and you cover your face if it's flu sleeves. You do preventative care when you as far as passing on bacteria, and then you're allowed to go back to wherever your babies are, and you're allowed to go. I think the only time the unit closes is when shifts are changing. So from 6:30 to 7:30, they close the unit.
Okay.
And at night after 10, you can't stay past 10. And you can go as early as like 7:30 in the morning. So night's off limits unless there's a special scenario. But I basically went home and showered and went right back. And I spent my days, I would wake up, have breakfast, Micah would leave for work, and I would go to the NICU unit and I would sit with them outside their incubators. And Kangaroo care is a big part of just keeping them skin to skin as much as they could tolerate, because their bodies were so fragile. To move a micro-preemie requires an immense amount of like caloric, what's it called? Output. And so you don't want to move them too much, but that Kangaroo care is really important. And so once a day, I was allowed to do Kangaroo care for about 20 minutes when they were really little.
What did that feel like? What did it feel like?
I can't really explain it because they were so little.
I would just imagine that you would feel like you were healing them.
Yeah, it felt like a very vain attempt at trying to love your child. It felt like this is all I can do. And I had to be you have to be so still, but you're supposed to be calm because they can hear your heartbeat. And there's a lot to it that, the nurses help you with, but it was really hard actually for me because I just felt, it didn't feel like enough. It didn't feel like I was, like I could do enough. I'm watching them. I'm sitting there, we decorated their incubators with pictures of us, and we had little recordings of our voices and singing to them and praying over them. And they would play those like once a day, and everything's very calculated in the NICU unit because you want them to have as much of a calm, steady, consistent environment so that their bodies can grow. And, apnea and bradycardia are big parts of lung development. They stop breathing and then they start again, and the monitors go off with all of that. And so my days were, especially the first 6 weeks, were just spent, watching the monitors go off and the nurses come over and readjust their, first they go from their ventilator to a CPAP machine to a nasal cannula, and they learn to breathe on their own.
And these are all just huge milestones.
They're huge milestones, yes. And you celebrate those victories. And, everyone told us when we first got into the NICU unit, this is another world, and it's 2 steps forward and 1 step back. You will get out of here. No 2 experiences are the same. And there were other families in there, and there's not a lot of talking. You don't really talk to the other mothers. The nurses, the 2 nurses that were at my birth became my friends during my stay, and I still keep up with them because they had just such a profound, they knew me at a time that nobody else did. And they saw my births, and they would, if they were on here, they would say that the births of Mason and Isaac were some of the most dramatic and traumatic that they'd ever seen a baby go through and then survive. They could not intubate Mason, which I didn't get to all this, but meaning they couldn't get the tube down his throat to get any kind of carbon dioxide return. And they tried several times, and they just weren't able to get it in there. And then the neonatologist literally walked in, and she slid it in like it was butter on that like 3rd try. Okay. And the nurses had tried. Both of them had tried. And they're miracles. I mean, these NICU nurses see miracles, I feel like, all the time. But Mason and Isaac were pretty special.
So special.
They're so special.
So did your milk come in?
No, that was an interesting experience. That was pumped in.
Okay.
They literally wheeled in a pump to me the first night I was there and started telling me to start pumping. Okay. My milk did not come in. I pumped it in. I was pumping and trying to get my body to respond to the pump machine. And then when I went home, I went with that hospital grade pump home, and I had pictures of the boys, and I would sit and look at their pictures, and my milk did come in to some degree with that. And I would pump near their incubators. Every 3 hours I was pumping, and I was producing very, very little milk.
Okay. But they were giving them?
They were giving them, yes.
Okay. Which is like liquid gold to a Micro-Preemie.
Yes.
At a Micro-Preemie, there is no formula that is going to give their bodies, what your milk could do. And this is why we have milk drives and milk donations for preemies and Micro-Preemies. Mm-hmm. Wow. So how long did you do that for, pumping every 3 hours?
I pumped the entirety of their NICU stay, which was September 14th through Isaac came home December 15th, and Mason came home December 23rd. Mason stayed a little bit longer.
So how many days or how long was that in the NICU?
Roughly, just call it 3 months.
3 months.
I mean, three.
So they finished their pregnancy, basically, their gestation.
Yes.
And then were able to come home.
They were able to come home. Mason had eye surgery. And they were able to come home without oxygen, but they were on heart monitors because they were still having a fair amount of bradycardias and whatnot. So there was a lot of equipment with them when they first came home. But I pumped throughout that entire time, around in the middle of the night and all that.
Yeah.
And then I tried to get them to nurse, and it just wasn't. They were used to having, bottles, little tiny bottles, so I could never get it to work. And so I pumped for an additional 3 months. And around 6 months, I couldn't do it anymore. And I had a nurse come visit me, actually, one of the NICU nurses, and she saw me pumping. She was like, "You're still doing that?" And I was like, "Yeah, it's like the least I can do." And she said, "How are you doing with that?" And I just burst into tears. And I didn't know, how. I was like, it's actually awful. I'm so tired of it. And I feel like I'm not producing. And I was taking fenugreek. And I was pumping myself with anything that would keep my milk up. And oh my goodness, I was exhausted with it. And she was like, it's okay to stop. You have done it long enough. It is okay to stop. Nobody had said that to me.
Amazing.
Yeah.
I'm 6 months is so long and so amazing. I'm so proud of you.
Oh, you're sweet.
I'm trying to put myself in your shoes of going through everything that you went through and then going home alone and then waking up every 3 hours in the middle of the night without my babies to pump milk and bring it to them. And I'm just like, you're a freaking warrior. A warrior. So tell us how they're doing now.
So they're great. They're in 4th grade, and they, as far as, a lot of people want to know, from a health standpoint, what was that road like and what are they, how are they now? So, we had multiple surgeries particularly with Mason. There was a smaller one. He had retinopathy of prematurity, which back in the old days would have left you blind. And it's, I don't have to get into all the details, but he had a corrective surgery for that. And then he developed craniosynostosis, which is a rare fontanelle, where your soft spot is. Those fontanelles, they're called, they're supposed to, over time close.
In your skull.
And his closed prematurely. And so he had a massive head reconstruction when he was...
Because that would prevent the brain from growing.
And he was, at a year old, he was 14 pounds, failure to thrive, very sick, and we didn't know why, and it was due to that. So he underwent with 2 phenomenal surgeons.
Stop for a second. 1 year old.
Yes, not quite even a year. 11 months.
14 pounds.
14 pounds. They wanted to put a feeding tube in him so many times when he was home, and I just...
Let me just put this in perspective for you. Max weighed 13 pounds on his 2-week appointment when he was 2 weeks old. My 2-week-old was the same size as your 1-year-old.
Yeah. And he was just pitiful. I mean, he was really unhappy, cried all the time, wouldn't eat, wouldn't drink, take a bottle. And we didn't know why. And a lot of it was because his brain was pushing on that front part of his skull, and it was painful to suck on a bottle, caused pain up there, as he would suck in, it caused pain up in his head. And that's a whole other podcast and another story about how we even found out that he had that condition. And fortunately, right after he had that, he started crawling. He wasn't crawling yet either at 11 months. So he started crawling and taking a bottle, and he started to thrive after that. Isaac they both had asthma as toddlers, pretty severe, I would say. I don't know how you rate asthma, but I mean, we were very routine visitors we were in the hospital with, RSV. We had, I can't even tell you how many trips in the winter, with colds that then led to pneumonia. And so as little people, they were very sick, and it just required a lot of staying at home. And they were in an in-home daycare when I went back to work, and that worked out pretty well because there were only a few kids there. And
I had a question for you about that. So when you deliver micro-preemies, what does maternity leave look like? And what is going back to work? I'm so confused when this happens. Your babies don't come home for 3 months. Do you have to go back to work at 6 weeks when your babies aren't even home?
Yeah, it's the same. It's
really?
The same. It was all the same. I mean, there was no
You don't
extra.
get a second maternity leave when they come home from the NICU?
No, I mean, I was so glad they kept my position. I stopped working for 6 months.
Oh, good for you. Because I'm that makes me so angry. So if you live normal people, you would just have to go back to work right away. Right. And then your babies come home and then you have no time with them at all.
It's so sad. NICU, I mean, there were a lot of babies that didn't have moms sitting by the incubators because they had to go back to work.
Oh my God, that just makes my heart break. I hope there's I would just pray that someday some CEOs all over listen to this and say no.
There should be a change in that.
If your baby comes home, you get time off again. Yeah. Or we're not going to make you come back to work until your babies are home with you, and then you've had family bonding time.
Right.
Okay, anyway, sorry.
All right, so they were sick, both wearing, little kid glasses and all that kind of stuff.
Cute.
Very small up until, I would say, when they turned 5, they stopped seeming as small. For a while, you kind of correct their age. So, for the first year, we would say they're 6 months, but corrected age, they're 3 months. Because it helps people understand why they're so small. Okay. And then that kind of fades out when they start to blend in as far as size goes. Now they are average height, average weight. Nobody's extremely tall or extremely short. Mason had speech therapy for a fair amount of time, physical therapy as a little guy, physical, speech, OT, all of that when he was real little. And speech therapy carried until he was in 2nd grade.
So pretty much Mason had the brunt of the issues, right? And he was just a few ounces smaller.
Right.
And he was probably conceived, as we talked about, a couple of days. When you said earlier, every day matters. Mm-hmm. Just those few ounces, those few days made the difference in Isaac's strength.
Yes.
And, Mason having to have more surgeries and things than Isaac.
Yeah.
So, okay, before we finish up, there is a story I want you to tell about you and Micah spending the night with you probably have no idea what I'm talking about, but spending the night with the babies in the hospital. Do you remember this story for the first time? And Micah thinking,
oh, yes. Okay. This is a funny story.
Okay, yes. I just want to there were some funny moments. You were able to have some laughter and some funniness. And I just want to share this story.
So you got to understand Micah is an incredibly deep sleeper. Like, he's not a morning person like I am, and he's a very deep sleeper, always has been.
Okay.
So right before they send you home with preemies, the nursing staff in the NICU like for you to spend a night with them, with the babies in a maternity room where you would normally deliver, but they wheel the babies into you, and they basically say, like, care for them through the night. And if you have any questions, anything with the heart monitors, because you've never had the babies through the night yet. So it's a way to kind of ease you into bringing them home. So we get there, and Mike has kind of got his pallet lined up or set up over by the windowsill. I'm in the bed, and the boys are in, it looks like a big, huge, ginormous cage kind of crib, and they're co-bedded together in there. I've got all my pumping stuff, all the milk and everything. We watch a little TV, go to sleep, and the boys woke up like probably every 2 hours throughout the night, and I'm like taking one and feeding them, taking the next one, feeding them, and Micah is like passed out. And I honestly didn't even have a ton of time to like wake him up. As soon as I would put them down, I'd fall back asleep. And I would think next time he'll hear them cry. I mean, because their cries are pretty loud. He'll wake up in 2 hours, you know? So I think it's probably 5:30 in the morning, and the boys are sleeping, and I had just put them back after feeding them, and I laid down in the bed, and Micah like jumps up from his little bed, and he's like, "Oh my gosh, we forgot to feed them." And I look at him, I'm like, he's like, "What time is it?" And he's all like completely disoriented, like where he is, he forgot to feed them. I'm like, "Yeah, no, we didn't forget to feed them. It's like almost 6 a.m. He's like, "Oh my gosh, I thought we just like forgot them all night."
And you were like, no, I've been taking care of them.
No, I've been feeding them like literally all night. They wake up every 2 hours. And I don't understand how you didn't hear them crying. He's like, "I didn't hear anything." Like, well, I'm glad you slept good.
So many moms.
Oh my goodness.
Oh my gosh. I have had many moments where, my own husband was like, "They slept through the night." Nope. Absolutely.
I think you just have I just have an ear,
Yeah,
you know,
it's different. It's like you feel it. I actually even still now will it's weird. I will wake up literally about 30 seconds before one of them comes in my room. Like I'm just synchronized. I can tell they're coming. I'm synchronized.
Yeah, totally.
It's so weird. So, oh my gosh, it's just so funny. Well, before we end, tell us about what your favorite baby product or baby products.
So I don't know. This is 10 years ago, but one of my favorite.
Maybe they're still on the market.
They are. I looked them up. So have you heard of the baby briefcase?
Mm-mm. I have not.
I'm super organized. So keeping all of the pregnancy paperwork, all the doctors, like anything the doctor gave me. And then I would say into like the first year of different doctor's appointments, place for your birth certificate. It's an organization like file system. It's literally, it looks like a briefcase, and it has all these different sections. And it helped me keep anything pertinent that I needed organized.
Okay.
It's called the baby briefcase. And you can buy it on Amazon. I'm not supposed to say
No,
weird.
you can say Amazon. Okay. That's fine. I'll put a link to it.
It was normal. It was given to me. And at the time, the only place you could buy it was Nordstrom.
Okay.
And I know they still sell it at Nordstrom, but I found it on Amazon. It's it's like $30. It has like it won some sort of medal for like baby products back in the day. And it was a gift to me at one of the showers that I did end up having. And
after
I still have everything that I used from the boys. And so it's also like a safekeeping type thing too.
Yeah. For all the memories.
Yeah. And when you get your growth, you leave your pediatrician office and you see their growth milestones and whatnot in the charts, it's a place to keep it all.
It's like your baby journal, but in a little organized briefcase. I love it.
That's one. And then little giraffe blankies. Mm-hmm. I think those are my favorite, only because the boys each had one that's like so ratty. It's in their keepsake box. They started sleeping with those when they were little, and they just They went everywhere with us, and
We have 2 of them.
I just love them. And I know that they're, not a true baby product, but I think when I look back at them as
just
babies,
so
they're so
soft.
stinking soft.
Yeah.
So those were also gifts, and we ended up having to replace them a couple times. But
I will link.
those are my 2 favorites.
Oh, I love it. And I'll link to both of the products in the show notes. So if any moms want to pick them up. So Gail, I love you so much. Thank you for sharing your story.
Thank you.
And I hope the boys get a chance to listen to it too
will one day.
Someday.
One day. Thank you for having me.
Yep, thanks. Thank you for listening to Birth Story. My goal is you will walk away from each episode with a clear picture of how labor and delivery might go, and that you will feel empowered by the end of your pregnancy to speak up, plan and prepare for the birth